So we're live or not?
You're on live.
All right. How's everybody doing today? We're here with our patient again. She's had 2 rounds of Sculptra, which is a facial injectable that basically stimulates collagen growth in the area that's been injected. So how has Sculptra helped you, do you think?
It definitely made my skin smoother and fuller. And I love the fact that people stop and ask me what I've done to my skin because it looks so good. And I like that. It just, I feel better. I feel pretty.
Well, that's good.
It's good, yeah. So
And
it's good.
have you noticed a difference in the wrinkles or
Yes.
folds in your face?
So the wrinkles around my eyes have definitely gone away. And the folds, I'm going to say on the right side, they're like almost gone. And the left side is much less. This was like my worst side. But
Okay.
yeah, totally. Yeah.
So last time we basically injected Sculptra kind of like in this area, down here, and some down here. And it's given her more fullness into the cheek region, into the malar complex. And that's kind of brought her skin in this direction, up this way. Also injecting back here is pulled back here, so it's decreased this fold, and she has more volume down here, so it has decreased some of the wrinkles in that area. And same for this area. If we look at her before and after pictures, these areas have definitely decreased, and this is pulled back more, so she has more volume in this area.
I feel like my face looks like when I was a kid. It's like fuller and I have like bigger cheeks.
Good.
Yeah.
All right, so she's had numbing medication on for about 15-20 minutes. The Sculptra actually has lidocaine in it, which will numb her face also. So this portion of her face will become numb after the injection, and that lasts for about 2-3 hours or so. Okay?
Mm-hmm.
All right, so here's the injection. Just try to relax. Yep. Pinch 1, 2, 3.
And actually this injectable is one of our Black Friday specials. So it's buy 2, get 1 free. And that is until the end of December.
You can see she's pretty comfortable. There's actually a nerve right here, which will give her numbness to this area. We're going to inject a little bit back here also. The other side. This is the video.
Mm-hmm.
All right, so now we're going to do this side. Pinch.
It must be all your viewers, Debbie.
Mm-hmm. Yep.
They're texting us already. I want Sculptra. Get a pinch. This area back here is going to pull the skin back towards her ear, really. It almost is like a liquid facelift, because it's basically pulling back in this direction. So it's going to give her volume here and pull back this way. It's going to decrease this fold.
Good.
And her skin definitely looks tighter from previous injections. When I looked at her pictures before this injection, you don't see as many lines here, the crow's feet. That's definitely decreased on both sides. So when we compare the pictures, you can definitely see that has decreased those areas of those wrinkles there. And then down here also decrease in the wrinkles down there. Some people, when you do research about Sculptra, you'll read about lumps and bumps. That's pretty uncommon. I used to see that more when we would mix Sculptra up the day before or that day. We mix Sculptra up about 5 to 7 days ahead of the patient getting injected. So it really will decrease the risk of getting those bumps and lumps. And then she will massage for 5 minutes, 5 times a day for 5 days. And that will also decrease the bumps and lumps. And you can see it's already decreased some of the folds in this area just by putting volume in. And over time, the Sculptra will stimulate the body to create collagen in this area and will decrease some of those folds. How do you feel?
Good. Great.
How was the injection? Did it hurt?
Nope. No. It was good.
So, patient tolerated the procedure really well, and we'll see her back in about 4 to 6 weeks, and we'll see how much more of a better quality of her skin, more volume in her face, and see how she feels about how she looks.
Sounds good. I will post before and after pictures.
Yay.
Take care.
Bye.